Good evening. Welcome and thank you for attending our Ahead of Cancer lecture series this evening, sponsored by the Allegheny Health Network Cancer Institute. My name is Michelle Stednicki, and I'm one of the project coordinators for the Cancer Institute. There are a few housekeeping items that we would like to review before we start. Number one, during the presentation, all participants can type questions into the chat or Q&A section of the Zoom. We will be addressing those questions at the end of the lecture if time allows. Number two, participants are not able to speak during the conference, but again, we encourage feedback via the chat option. Our topic tonight is Stronger from the Inside Out, Whole Person Healing when Fighting Cancer. We are excited to have Dr. Sarah Miller and Shannon Altpeter joining us this evening. And I'd like to take a few minutes to introduce them and give you a glimpse into their outstanding work that they're doing at the Cancer Institute. So Dr. Sarah Miller is a dedicated board-certified medical oncologist, hematologist at the Allegheny Health Network, where she has been an attending physician for over 14 years. She leads the integrative oncology program at Allegheny Health Network and is passionate about bringing a holistic approach to cancer care. Dr. Miller completed a fellowship in integrative medicine from the Academy of Integrative Health and Medicine, complementing her medical degree from the Philadelphia College of Osteopathic Medicine and a residency at the Western Pennsylvania Hospital right here in Pittsburgh, PA. Focusing on breast and gynecological malignancies, Dr. Miller is committed to incorporating integrative medicine to enhance the well-being of her patients throughout their cancer journey here at AHN. Now for Shannon Altpeter is a physician assistant here at Allegheny Health Network. She is a surgical oncology physician's assistant committed to providing patient-centered care and improving health outcomes through a collaborative teamwork approach. She graduated from DeSalle University with a master's degree in 2011 and obtained her doctoral degree from the University of Lynchburg in 2023. Shannon's experience in treating peritoneal serous malignancies allows her to provide comprehensive perioperative care, contribute to the research and clinical trials, and work effectively with a multidisciplinary team to support patient recovery and well-being. Welcome, Dr. Miller and Shannon. I'm going to turn it over to Dr. Miller. Thank you.
Thank you very much. Happy to talk to everybody tonight about our integrative oncology program. And hopefully, let's see if the slides will let me advance. I'm having one of those technically challenging days with the computer, but okay, it looks like it's going to work. So what I want to talk about is just basically what is the definition of integrative oncology, such as the differences between complementary and alternative treatment modalities, focus on several specific treatment modalities that are available to our patients at AHN, discuss the safety and benefit of some supplements, as well as the use of medical marijuana in our patient population, as well as what patients ask all the time about potential lifestyle modifications to reduce cancer risk, and go over just exactly what we're doing. So important definitions before we start out. Complementary medicine is the use of a therapy in conjunction, so alongside conventional medicine. Alternative medicine is the use of a therapy in place of conventional medicine. And integrative medicine / oncology is using evidence-based complementary medicine practices alongside our conventional oncologic care. So integrative oncology, it addresses symptom control. We try to do that with non-pharmacologic therapies because our patients are usually taking a lot of pharmacologic agents and don't want another one. It's evidence-based, meaning that it's been studied extensively as an adjunct to mainstream care. Goals are to improve the physical and emotional health of someone. Therapies are considered non-invasive and safe, and as I mentioned, they've been studied. They demonstrate safety and benefit. So it is not alternative-based therapies, which are often promoted as anti-tumor therapies, where there's little scientific evidence of safety and efficacy, and these therapies could have the potential to cause harm. So complementary therapies, these are just some examples of several different modalities. When I will talk more about those as we go along here. So patients seek out complementary therapies to improve their overall health and well-being, as well as to combat the adverse drug reactions that they're experiencing from their cancer care. The goal is always to improve quality of life during and after their cancer treatment, and it gives patients a sense of control over their cancer treatment as they are able to pick what complementary treatment modality they would like to try. So I meet with patients during a designated time of the week for all AHN patients across the network that are in our oncology system to talk about integrative oncology if they're interested. And so what we do is we go over the complementary treatment modalities that are available to them, and I try to recommend a specific treatment modality based on their current side effects that they're having. We also address exercise, nutrition, the use of supplements, support in the community, as well as behavioral health. So one of the most popular complementary modalities is acupuncture. So this originated from Chinese medicine. Needles are inserted in specific points. Animal studies have shown us that there is increase in the feel-good neurotransmitters such as dopamine and serotonin following a treatment. The NCCN stands for like the National Comprehensive Cancer Network, and we use their guidelines a lot to help guide us in our treatment of our cancer patients. So this society recommends the use of acupuncture in our patients, specifically to help combat pain, fatigue, nausea, vomiting, and hot flashes. So acupuncture is one of the most studied complementary treatment modalities. So there was actually a large study, which over 200 patients that were breast cancer survivors and were taking aromatase inhibitors, which is a treatment to prevent recurrence of their breast cancer. And patients were experiencing joint pain and hot flashes. And what they did is they separated patients into 3 groups. One group got the real acupuncture, the other group got acupuncture, but the needles were placed in not the appropriate areas. And then there was just a control group that filled out surveys. So what was interesting about this is that the actual treatment group had a statistically significant increase in the amount of pain that was reduced versus the non-treatment group. So because they had the real acupuncture group and what they called the sham acupuncture group, it was notable that like the placebo effect was avoided in that trial. So that was one of the most encouraging studies. These complementary modalities would then eliminate a need for a patient to take an additional medication to alleviate the side effects from another, which is always welcomed. And it also helps enhance patient adherence to prescribed therapy. Additional benefits, I mentioned you could improve cancer-related fatigue, pain stemming from chemotherapy-induced peripheral neuropathy, relief of chemotherapy-induced nausea and vomiting, decreased frequency and severity of hot flashes, as well as decrease one's overall stress. Another complementary modality available in our program is massage therapy. So in the oncology setting, we use this to reduce cancer-related fatigue, improve pain, mood, decrease lymphedema, as well as decrease nausea. So there's an adaptation in oncologic massage. The massage therapist is certified and knows about changes in different applied pressures that they have to use, as well as site avoidances and restrictions specific for our patients. So Reiki, also available at AHN, means universal life energy. And this is based on the idea that a practitioner can promote healing by encouraging the flow of energy. Small studies have shown that Reiki helps improve one's pain, anxiety, and fatigue. There's virtually no side effects or contraindications. I just stress to patients that this treatment modality is solely to alleviate side effects, but doesn't overall impact the status of their cancer. There are many mindfulness-based interventions that our behavioral health team reviews with our patients. We know from large studies that mindfulness-based strategies for stress reduction lead to a decrease in depression, anxiety, improve someone's fatigue, helps their sleep quality, as well as decrease pain. So There are, along with our AHN behavioral therapy, we also can look at several, there's complementary sessions on YouTube, but that it does take a lot of practice that teaches how to relax and participate in these kind of interventions. We also stress the power of movement, and just two examples are yoga, which is a meditative movement practice that originated from Eastern medicine. The whole goal is to join the mind and body through breathing and different postures. There's different forms of yoga. In our program, we've recently started the movement and breathing class that is a very gentle yoga that anybody could participate in. Tai Chi is something that is another form of exercise that's based on Chinese martial arts. And this has also been proven to be safe and very gentle, used a lot in elderly patients that are disabled patients. We have a lot of data that shows that it improves balance and reduction in the number of falls. And in oncology, there was actually a trial that involved our lung cancer patients that were on chemotherapy that showed an improvement in fatigue. Another topic that commonly comes up in our integrative clinic is natural products. So we're talking about herbs, vitamins, minerals, probiotics. It's been eye-opening for me thus far to realize how much of these things are out there and how many patients are using them. We totally are not against the use of such things. We just have to make sure there is not a potential for harm. So the four categories that are often cause the most interactions, we worry about high doses of antioxidants. So we would worry that if somebody's taking very strong antioxidant in a large dose, that might actually combat the efficacy of the chemotherapy and radiation. We worry about the blood thinning effects of certain herbs, since a lot of our patients have low platelets, undergo frequent procedures, and are on blood thinners at baseline. Phytoestrogenic herbs, which may interfere with hormone levels and negatively influence our treatment of hormone-sensitive cancers, as well as direct organ toxicity, such as kidney and liver injury. Additional concerns for natural products is the lack of quality control. There's also historically just been a lack of dialogue between the patient and the treatment team. Fortunately, we have the Society of Integrative Oncology that also endorses guidelines that state that there really is no evidence to support the use of supplements routinely throughout cancer treatment. But at the same time, we can use at times a supplement to possibly treat a side effect of their therapy. I just listed some of the natural product databases that our pharmacists would use to see if there's an interaction between a particular supplement and their chemotherapy. Another common question I get is about the use of medical marijuana in our patients. So just brief background, it's a Schedule I drug. It's regulated by the U.S. states for medicinal and or recreational use. THC is the substance that causes quote unquote the high. THC has been known to help with pain, sleep, nausea, and appetite stimulation. There's also CBD, which is available without a certification, an actual certification for your medical marijuana card, that has been studied as an anti-seizure medicine, helps with anxiety, anti-inflammatory, and reduces pain. So if we have a lot of patients, this has really come into use, gained popularity over the past, 5 to 10 years. And we don't always know about the drug interactions that we may see. So our breast cancer patients specifically, in one survey, up to 40% of patients were using medical marijuana. Most patients do understand that there is a risk associated with use, but up to 85% of patients perceive benefit to cannabis use as well. So basically, concerns with our patients, there's no proven anti-cancer properties that we know of. It's not recommended specifically for a cancer treatment, just to help alleviate side effects of cancer treatment. There's something called hyperemesis syndrome, And what that is that's a lot of nausea and vomiting. This most often develops after daily marijuana use and over a 10-year duration and resolves with drug cessation. So patients hear about this and are concerned, but generally it does not happen with our patients. Interactions with cancer treatment, most interactions, as I mentioned, with chemotherapy are unknown. We do have a study with 200 lung cancer patients that were receiving a drug called pembrolizumab, which is a form of immunotherapy. And the medical marijuana use did not appear to negatively or positively affect the cancer-related outcomes. So where does it leave us? A lot of questions. The Society of Integrative Oncology and the American Society of Clinical Oncology and the NCCN are the the guidelines that we follow to try to help tease out the benefit, the risk versus benefit of specific complementary treatments for our patients. So they partnered together, and this is just an example of what one of the guidelines is. And it shows that for anxiety and depression, this is an example for that they separate things into during active treatment and post-treatment for both. And they're very similar, but they would recommend mindfulness-based interventions, relaxation therapy. I thought interesting lavender essential oil inhalation. There's a wide breadth, and this is based on the amount of data that we have behind each of those modalities. This one guideline is integrated medicine for pain management and oncology, and then it breaks it down into the specific types of pain. So joint pain from one of our breast cancer treatments called aromatase inhibitors, there's the most evidence available supporting acupuncture and yoga. Whereas surgical pain, it appears that we have evidence that music therapy, also along with acupuncture, has been most beneficial. So it's interesting, and it's nice to have these guidelines to help reference for our patients. This one is for management of fatigue during and after cancer treatment. One supplement that was found to be safe that one can use during treatment and often doesn't interact with therapy is a supplement called American Ginseng. And that has the most data and is on these guidelines, along with exercise and cognitive behavioral therapy. So it also tells us that we should not recommend stimulants, agents that particularly would keep one awake, as they have been found to have more harm than good. All right, so specifically the guidelines surrounding the use of medical marijuana is that it's purely medicinal, and right now the guidelines are only supporting the use of cannabis as a management strategy for chemotherapy-induced nausea and vomiting. It doesn't mean that they don't agree that it helps with other side effects, but they feel that this one has the most evidence behind it. So dietary supplements and cannabis use is high, and as I mentioned, there's limited data supporting the efficacy. So certain recommendations can be made, such as to avoid vitamin D deficiency. We know that maintaining a normal vitamin D level in our patients is often associated with a decreased risk of cancer recurrence. I mentioned lavender aromatherapy for anxiety, surprisingly, has a lot of data backing it as being useful. Ginseng for fatigue, and we can recommend cannabis use for refractory nausea and vomiting. So potential, again, for interactions with supplements can be very high. So it's essential that a pharmacist make sure that the intended supplement and the prescribed chemotherapy are not interacting, and specifically making the chemotherapy more toxic for the patient. And other effective approaches should be considered, for health promotion, such as nutrition, physical activity, acupuncture, and the complementary modalities that we mentioned, such as massage, yoga, and meditation. All right, so this study looked at diet, nutrition, and physical activity for patients that had already been diagnosed with breast cancer. So a lot of these really big studies have looked at kind of what prevents the cancer diagnosis to begin with. And this study looked at, okay, after someone's diagnosed with breast cancer, what are the certain environmental lifestyle modifications that can be made that can help reduce the risk of recurrence. So this is what they had established for initial prevention, and it's mostly stuff that everybody's heard of before, such as limiting the consumption of like red and processed meats. You want to be physically active. Everything that you've really heard before. Nothing surprising there. And then this particular study looked at 4 different types of diets in patients that had been diagnosed with breast cancer. These are the 4 diets they specifically looked at, but they're all very similar. There's some nuances between them, but they both are very heavy in fruits and vegetables and discourage frequent intake of red and processed meats and added sugars. And what was interesting is, I don't know if you could see my pointer, but it wasn't so much the diet that was followed, it was how well someone followed a diet. Meaning it was the lower heights mean the more effective. So as someone follows the diet the most frequently, the highest frequency of following the diet was associated with the lowest risk of mortality. All right, so some of the conclusions that we've drawn since starting our program is that insurance policies rarely cover complementary treatments, which make things difficult. At AHN, we have it's called AHN Reflections Program that does provide complementary treatments to patients, vouchers for such, so that is very nice and welcomed. We want to make therapies accessible to all. The vendors that participate in our complementary vouchers are not all over our area that we need to encompass, most likely just in the city and in the north. So we're trying to make the acupuncture, massage, and Reiki available to all our patients across the network. And just as speaking as a medical oncologist, it's hard to have time to incorporate this discussion of all these different complementary therapies into a patient's appointment, because as you know, you're going through labs and talking about treatment, and it's very difficult to have the time or even mental energy to ask questions about complementary therapies. So the goals of our integrative oncology program at AHN is an appointment to discuss complementary modalities in detail, time reserved for that. We do counseling on safety of supplements and medication interactions, provide a comprehensive overview of all services available at AHN, as well as those available throughout the community. And we want to make these treatments accessible to all of our patients. So again, complementary therapies have been tested in terms of safety and benefit. Alternative therapies have no scientific evidence to support safety or efficacy. Complementary treatment modalities that are offered through AHN through our Reflections program include acupuncture, oncology, massage therapy, and Reiki. And the goal of our program is to enhance the quality of life of all our patients throughout their cancer journey. And that's our phone number to call to schedule appointments, and my email if there's any questions. So that is it. Thank you very much.
All right. And thank you everyone for having me tonight and sharing this presentation with you to focus on Stronger from the Inside Out, whole person healing when fighting cancer. I am a surgical PA, so a lot of what I'm going to be focusing on is around a surgical patient, but what I'm going to review is available to all oncology patients. So I wanted to mainly focus on prehabilitation and rehabilitation. I'll break this down into mental health and physical health. And a shout out to Dr. Miller and integrative oncology, because that's absolutely a part of this. So these are your traditional treatment options that your clinical team is focusing on. And patients are a part of that decision-making for these treatments, but ultimately, many patients feel that they have no control in the outcomes. My best advice is to relinquish that concern to the best of your ability to your treatment team and focus on the therapy you do have control over. Focus on bringing the best, healthiest version of you to the treatment table. Focus on mind and body health or whole person healing. There is ample literature supporting this focus to increase response to traditional therapies and increase overall survival with cancer. Mental health is a key factor to consider during a cancer diagnosis journey. I would argue one cannot have whole person healing without it. Depression and anxiety can either precede or post-date the diagnosis of cancer. It can also be acute or chronic, which means temporary or long-standing. Within the first 5 years of a cancer diagnosis, 38% of patients will experience depression and anxiety. And I do believe that we're likely undercapturing that number. The diagnosis is directly linked to worse outcomes and poor response to cancer therapy. Globally, it is one of the biggest factors contributing to disability and premature death. It requires early identification and treatment to improve oncological outcomes, as well as overall mental health wellness. I urge you to be proactive rather than reactive when it comes to mental health. So there are many options for your mental health support, and I would like to review several. Patients should strongly consider a mental health coach or a therapist from the time of diagnosis. A mental health professional with experience in treating cancer patients can provide a safe space for communication and instruct you on coping mechanisms that are needed for every step of the treatment journey. Many times in clinic, I tell patients to appoint friends, family, neighbors to be members of your support group. And each person is selected for their particular gifts. If you have a friend that you know you can rely on for laughter, a family member that is always a good shoulder to cry on, that has that empathetic ear, a neighbor who can give you that physical support when you need it during treatments and that you can't carry your own groceries. Your best friend that is really good at research and can give you all that information that you need to prepare for your visits. Mindful-based intervention is the practice of recognizing bodily sensations as it relates to a cancer diagnosis and/or treatment without further interpretation or investigation. This type of cognitive therapy allows the patient to break away from the reactive analytical thoughts and move towards acceptance and healing of unpleasant sensations. A major breakthrough for depression and anxiety is the disruption of the dysfunctional thought process. And there's a recent systematic review and meta-analysis reviewed 36 available studies on mindful-based intervention and concluded that this form of treatment is effective in reducing symptoms of depression and anxiety in cancer patients. And then I just need one. There it is. Okay, sorry, I lost my mouse. As survivorship improves for patients with cancer, many are living with long-term mental effects. Even in the survivorship period, patient outcomes can be improved with long-term treatment options for depression and anxiety. There are many forms of yoga that have been practiced for centuries. Each practice offers a holistic or therapeutic effect on mind and body. Yoga reduces stress, depression, anxiety through breathing techniques and physical activity. Patients report better coping mechanisms, improved mood, and better stress management with consistent yoga practice. A systematic review and meta-analysis reported that prescribed amount of time is about 60 minutes a week, but adherence can be low. So again, why we're encouraging and making this more known to our patients as an option. Music therapy is also an adjunctive therapy with the potential to decrease a patient's anxiety. This therapy is conducted by a certified instructor in an approved music therapy program. Methods include listening to prescribed music, singing, playing an instrument. The aim is to increase one's positive attitude and acceptance towards their disease, regulate emotions, and improve quality of life. Aromatherapy is another alternative as complementary medicine. It is a potential alternative for patients with cancer with symptoms of depression and anxiety that want to avoid the side effects of prescriptive drugs. The practice uses essential oils, which are natural substances extracted from plants. The oils are either inhaled or absorbed through the skin through massage. Stimulating the olfactory system has positive effects on the olfactory system itself and the hypothalamus, which incites the release of serotonin and dopamine. Aromatherapy can have a positive impact on reducing anxiety, especially when paired with massage therapy. Art therapy has been used as a therapeutic treatment option in various areas of mental health. A cancer diagnosis and treatment journey can evoke various emotions ranging from anger to sadness, not just depression and anxiety. In many ways, it is a trauma, both mentally and physically. Art therapy is a form of psychotherapy done by trained therapists to use art media as a form of communication to reach therapeutic goals. Patients are instructed on the art medium and provided plenty of supplies, but generally are free to make spontaneous art during a chemo session, for example. In most forms, the patient is invited to detail and express what their artwork meant to them. This method becomes a new avenue for communication and expression of feelings with a trained therapist. There are many options. Not all of them will appeal to everyone, but consistent use of one or many can only benefit the individual. Many of these options are even used simultaneously. For instance, massage and aromatherapy, or music and art, and yoga and music. Next, let's move to physical health. And this can have a very obvious role for Stronger from the Inside Out, but I think it's often ignored or overlooked. Being active and doing the things you enjoy is encouraged, but does not replace exercise, nutrition, and medical optimization. For example, obesity is a major problem in our country and is a modifiable risk factor for several cancers. Increased adipose tissue and that's the extra fat tissue, is associated with certain biological and physical changes that promote an inflammatory state. It is also linked to higher rates of morbidity and mortality as it relates to surgery. A sedentary lifestyle or an inactive lifestyle is also a modifiable risk factor for several cancers. Deconditioning can be associated with poor tolerance of therapy and increased complications after surgery. Lastly, uncontrolled or even undiagnosed medical issues can hinder cancer care, which prevents the goal of being stronger from the inside out and whole person healing while in therapy. Conditions such as hypertension, diabetes, COPD, chronic kidney disease, when uncontrolled, can decrease or even prevent the effectiveness of some cancer therapies. There is plenty of research invested into the link between nutrition and cancer, both negative and positive effects. Changes such as increased protein and whole grains assist in physical tolerance of cancer therapies. Dietary therapy specifically can also significantly reduce symptoms of depression. Impressively, sustained dietary therapy can have lasting effects on decreased depression after 12 and 24 months. As your treatment changes, your nutritional needs will change. I encourage all of our patients to discuss with their treating team and their PCP about tailored programs for you. There are nutritionists available to you at AHN. And let's see. So healthy diet. This info is from the World Cancer Research Fund and American Institute for Cancer Research. Number one is no smoking, no alcohol, no drugs. There is not a safe amount of these, and there are resources available to you for the cessation of smoking, alcohol, or non-prescribed drugs. The healthy diet itself is comprised of 30 grams of fiber daily, and these are your whole grains, fruits, vegetables. About 1 to 1.5 grams per kilogram of protein daily. So we weigh you in your kilograms, and however that is, take at least 1 to 1.5. So an average person of 70 kilograms, we would want at least 70 grams of protein daily. We look for 5 daily servings of your non-starchy fruits and vegetables, plenty of water, and then focus on eliminating your sugary or sweetened beverages. You want to limit or remove processed foods that are high in fat, high sugar. limit red meat to about 1 to 3 times per week, and limit or remove processed meats. Processed meats are your meats preserved by smoking, curing, salting, or the addition of chemical preservatives. And then please note that there is strong evidence or very convincing evidence for the recommendation to decrease processed meat, alcohol, and body fat. There is probable evidence for the whole grain foods and decreasing red meat, and there's limited evidence for vitamin C supplementation or multivitamins. So next, patients are instructed on gradual increase in physical activity. The goal is to reach at least 30 minutes of moderate to vigorous activity at least 5 days per week. Potential benefits are physical and mental and can improve oncological outcomes. So the guidelines for this, again, start slow and gradually increase. Many of our patients don't have exercise routines. And again, there are programs available to you at AHN where you can have one-on-one sessions with experts to provide you with structured exercise in a safe environment for every ability. So in general, we look for aerobic activity, about 150 minutes of moderate intensity per week, that's at 5 days, or 75 minutes of vigorous activity. To give you a sense, moderate intensity is going to be a brisk walk. You can still carry a conversation, but you need breaks. And then we want to couple this with muscle strengthening activity, where you're engaging all major muscle groups at least 2 days per week. We also are going to focus on reducing sedentary behavior. A lot of my patients, I describe to them, if you've been sitting for an hour, you got to get up and move for 5 minutes. You want to avoid weight gain and maintain a healthy weight range. Regular checkups with a PCP are encouraged throughout your cancer journey. Health issues such as hypertension, diabetes, COPD, chronic kidney disease, they still need to be managed and treated optimally to avoid an increase in complication rates associated with cancer therapy. All right, so I wanted to focus on one of our trials around prehab. So this is the prehab trial is the largest randomized clinical trial on multimodal prehabilitation. So multimodal meaning what I just described to you, addressing mental health and physical health. And this was done for colorectal cancer patients that were about to have surgery. And it provides a robust evidence-based strategy for optimizing before surgery. So again, patients with colorectal cancer, they were scheduled for surgery. They were assigned to either standard of care or a personalized 4-week multimodal prehab program. That program included exercise. This was a 1-hour session of aerobic activity, which they chose the bike, and strength exercises, which they used with resistance bands. And they did that 3 times per week, and they had rest days in between. The second part was nutrition. They had a personalized assessment to balance their macronutrients. Your macronutrients are your carbohydrates, proteins, and fats. The daily amount of protein of 1.5 grams per kilogram was used. And they were instructed specifically to consume 30 grams of protein within 1 hour after exercise and 30 grams of protein 1 hour before bed. They were also given vitamin D supplementation and a multivitamin. Mental health was the third part of this program, and that entailed relaxation techniques and deep breathing exercises that were provided by a psychology-trained person in a 1-to-1 session. They used very specific scales like the Generalized Anxiety Disorder Scale and patient health questionnaires to identify patients who needed further medical psychology. And then everyone was provided with smoking cessation. So I want to review this chart. As you can see, the blue is your standard of care, and your green are the patients that received this prehab program that we just reviewed. So severe complications around this surgery. The standard of care group had almost 30% had severe complications compared to only about 17% that received the prehab program. Medical complications, standard of care, again, about 27% experienced medical complications compared to only 15% in the prehab program. Admission to ICU is also a really unique feature. So if you can see, almost 11% of these patients that had standard of care went to the ICU compared to only 3% in the prehab program. And then lastly, I think this one really drives it home, is overall complications. 42% of the standard of care had overall complications compared to only 31.7% of your prehab patients. There wasn't any difference in surgical complications, length of stay or readmission, because I think that was pretty standardized and not what we were looking at in this trial. So why am I presenting this to you? Why does treating the whole person and assessing complications around cancer treatment make a difference? Because every patient's primary goal, aside from living, I don't want to take that away, is going into cancer treatment is to remain functionally fit and cognitively intact. These are crucial quality of life concerns. Complications can lead to depression, anxiety, loss of independence, and impact functional capacity. To quote the World Cancer Research Fund, cancer therapy is increasingly complex, and the role of diet, nutrition, and physical activity as an adjunct to therapy with the goal of improving the efficacy of treatment while reducing acute and long-term toxicity from surgery, chemotherapy, radiation, and the rapidly growing array of biological therapies is critical for success. I also wanted to highlight that there are an array of organizations that believe in this and they practice it and they want to offer it to patients that are going through cancer and their therapies, these opportunities for free. So these are several that are in the area. 412 Thrive, it has an exhaustive list of resources, including cleaning, medical supplies, utility discounts, wigs, fundraising events. The YMCA, we all have a YMCA near us. They joined with the Livestrong Foundation, and they created a free 12-week program for cancer survivors. Another big one in the area is Cancer Bridges. A lot of those therapies for mental health and physical activity, they offer to patients in the Pittsburgh area when they're going through therapy. One Day to Remember is a beautiful organization that offers a day to families, patients that have cancer going through therapy that have a young family. They offer them a day that you don't have to worry about and just stop forgetting about therapy and all the treatments and all the schedules that you have to do. There's a cleaning organization. Hearts of Steel are these beautiful breast cancer survivors that have taken up boating as their mental and physical health. So thank you again for letting me share this with you. I did want to highlight two of my former patients that really took this programs, these resources to heart. And I had one patient that always dressed up as Santa and volunteered at the Children's Hospital. And we made that a priority. We made sure that we prehabilitated and rehabilitated and were able to take breaks from cancer to achieve that goal for him. I have another former patient that just turned 90, 3 years out from surgery in their cancer journey. And because of following programs like this and avoiding complications and staying mentally and physically well, at 90 was able to have an art show and present that to all her friends and family. So thank you again. And thank you.
Thank you, Shannon, and thank you, Dr. Miller. Excellent, excellent presentation tonight. Looks like we have a question. So let me see here. Oh, no, we just have a comment. Somebody left us a comment. Thank you. So I agree with that comment. This was very, very, I've learned a lot tonight, so thank you. It doesn't look like we have any other questions. So if that's it, if there's no other questions, we'd just like to thank everybody for attending tonight's Ahead of Lecture Cancer series. As a reminder, tonight's lecture will be is being recorded and will be available on YouTube. Just check back at the YouTube channel and the Ahead of Cancer YouTube channel in a couple weeks. Also, if you need to make an appointment to see, if you need to make an appointment, if you know somebody who has cancer or needs to make an appointment, please feel free to call our Hope line, which is a line dedicated to new patients to the Cancer Institute who are in need of getting an appointment with one of our physicians. That number is 412-HOPE. Again, thank you for attending tonight. These are monthly events, so we'll see you next month. Thank you. Bye-bye.